I am Eva Hardin. I'm the Chief Nurse Anesthetist here at Henry County Medical Center. We are considered the frontline workers here at Henry County Medical Center for all the COVID-19 patients. When they come through the ER, if they're on the floor and go into respiratory distress, you will see us in the event that you need a breathing tube and to be placed on the ventilator. We have done 6 intubations for COVID-19 patients, one of which has been extubated and walked the floors of Henry County Medical Center yesterday for the first time in 12 days, which is an awesome feeling to know that she has recovered and on her way to recovery. So intubations with COVID-19 patients are different than our normal everyday intubations that happen in the OR or an ER patient that comes in respiratory distress. So a whole module and procedure had to be established in order to protect ourselves and other staff from this highly respiratory contagious virus. You have to have all of your stuff ready when you go into the room, so the stuff that you take into the room is not contaminated and of no use anymore. So you have to take just enough, but not too much. And of course, wear the proper PPE to intubate these patients, which includes a PAPR. So you kind of look like an astronaut for a couple minutes while you see these patients. We don't look normal like this. We have a hood on, we have a mask on, we have a jumpsuit on, and then a gown over all of that to protect ourselves and protect other staff from us contaminating them. Typically, these patients are very sick patients. They're not hemodynamically stable, so you have to be ready to resuscitate in an event that they start to plummet on induction, trying to get a breathing tube placed on these patients. Usually patients of this nature are on the ventilator for up to 2 weeks. It can be over 2 weeks, but typically here and in other places, you're usually on the ventilator for 2 weeks. Being that COVID-19 is a highly contagious respiratory disease, it is very, very important that you abide by the mayor's rulings to stay at home and in order to stay safe. We have not been impacted like New York, fortunately. In the event that we were to get a surge, we are a small rural facility. We are here to help you, stabilize you, but we cannot tolerate mass amounts of patients all at once. And when you gather in groups or outings with multiple people, a lot of the times as carriers of this disease, you have no symptoms. However, you can pass those symptoms and diseases along to other people not knowing that you've done that. So it's very important not to congregate in big groups and have birthday parties, pool parties, campfires. It's just very important because you never know if you're carrying that disease or not. It's a scary time, but if you'll do your part and stay home, we could end this pandemic quickly.